The emergency department is an interesting place in the hospital. So people typically are not having a pleasant day in the best case scenario when they come to the emergency department. So what we're really trying to do is make that experience as good as it could possibly be for anyone. We know we're not going to turn it into the best day they've ever had, most likely. So our goal is to make the care fast, high quality, and as efficient as possible, and also in a comfortable environment. And that's what we think we've really built here with the Fast Track Edition. My name is Sean D'Andrea. I'm the Director of Medical Services here at Sohotso Medical Center.
I'm so excited to open Fast Track. It seems like for the past year, maybe year and a half, it's been something that's been on the horizon, something super exciting. It's something that's been a huge undertaking from really the whole hospital, from the leadership up in the C-suite all the way down to the individual departments. Really, we've gotten a lot of backing, and everybody has gotten on board because it really is going to improve access for patients and improve access for healthcare for our community. All right, so I'm Alex Whalen. I'm the Interim Chief of Emergency Medicine here at Sohotso Medical Center.
The entire initiative of expanding the emergency department to include the Fast Track and some other additions that we've built are in response to recognizing long patient wait times. And
so I always like to reinforce this with the patients in the community is that your voice is heard. When you reach out to the hospital, when you reach out to our patient advocates, when you reach out to me, when you reach out to our clinicians throughout the hospital, your voice is heard.
And seeing, face to face when we see each of our patients that we're really not meeting their needs to the best of their expectations and our abilities. So, we actually absolutely respond to what we observe to be patient concerns, grievances about their care process, and that's 100% of what the Fast Track is in response to.
And unfortunately, change doesn't always happen super quickly, but I think this can be a prime example of the voice of the people pushing change. We hear those complaints, we hear those frustrations, and we sit down frequently and we talk about how do we make this better for our patients, for the community? How do we get more people in? How do we see them more quickly so they're not waiting in the waiting rooms, so that they have a good experience on a day that could be probably their worst, the worst day of their life.
When I started as the Chief of Emergency Medicine in September of 2015, one of the first things that I did to understand the department better was to look at how patients were using the emergency department, what kinds of patients we were seeing with what conditions they were presenting.
All right, so I first came out to Sohotso Medical Center as an independent contractor. Absolutely loved the work, loved the community, decided to stay on. Initially as the Deputy Chief of Emergency Medicine, kind of transitioned into the role of Interim Chief of Emergency Medicine, which is where I'm at now.
So what we found were a couple of things. We had a group of patients with a variety of conditions that necessitated care in the emergency department for up to 6 to 12 hours, but didn't require admission to the inpatient floor. We also noticed we had a very large number, over half of our patients were seen for relatively low acuity conditions, so non-life-threatening conditions, that is. So things like ankle sprains, minor broken bones, minor lacerations, skin infections, that sort of thing. So looking at that and the size of our department, which was only 12 beds, so we use some hallway space to accommodate more patients who really had very short stays, required minor care, but those number of patients overwhelmed the emergency department space. And so for that, we asked the administration for support in building a Fast Track space, which we were able to achieve and is opening in September of 2019, which is a 7-bed clinical care space where we'll be taking care of the vast majority of these folks with lower acuity conditions.
And I actually kind of inherited the Fast Track project from my predecessor, Dr. Sean D'Andrea, who had kind of initiated all of this stuff prior to my arrival here. And so I've kind of together collaborated with him as well as our lead APC, Jessica Salomon, to really take on kind of leadership roles in developing the Fast Track and making sure that we roll this out and keep our progress going to continue to improve our patient care here.
There are just so many people who have been involved and working hard. This has been an incredible project. It's come together in just over 3 years. That's really impressive. That's fast for any scale at any private hospital anywhere in the country. And I would like to share that with folks that the board of directors and the leadership should be commended for advancing this vision so quickly. It's really quite incredible how quickly we've been able to put this together.
Well, so this is the first time I personally have participated in a renovation construction project in a hospital setting like this, and it really has been eye-opening. It's been really reassuring to see how everybody within the hospital, I mean, not even just the clinicians, not even just the administrators, but the contractors, there's everybody on staff has come together and really banded together behind this project, because we saw a vision, we had a vision, we saw a way that we could improve care, we could improve access for patients. And although it has taken us several years to get there, I think this is going to be an enormous change, and really effective in addressing those concerns that we were seeing from the community and from patients.
Patients and community members can find out more about the emergency department, Fast Track, and other services we provide from a number of places on our website at www.fdihb.org/fasttrack. There's also additional information about the emergency department on the website, through Facebook as well. Just a Facebook search for So Medical Center.
So the emergency department Fast Track will be open 8 a.m. to 10 p.m. So as a patient, you can check in during any of those hours, and we are open every day of the year, Monday through Friday, weekends and holidays.
Our goals in the Fast Track and the entire emergency department when we see patients are that first and foremost, we're providing high quality care. So we want the care that is delivered to be the most up-to-date emergency and acute care that should be delivered, whether it's here or any other destination hospital in any big city. So that's our first expectation. But at this point, we really do expect it to be delivered fairly quickly as well, and I know our patients expect that. So we want our patients to see that our staff are working to provide care as safely and as quickly as possible.
The environment we want to create is one of safety. We want patients to come in and feel safe and feel like they're getting the care that they need. We recognize if you're coming to the emergency department, if you're coming to Fast Track, you're having an issue. And oftentimes that issue is serious. And even if it's not medically serious, it feels serious to you in that instance. And we really want to make sure that patients know that we're aware you're feeling bad that day, and we're here for you. We're here to care for you. We want you to feel better. We want you to feel safe. We want you to feel appreciated. And we want you to feel like you understand the reasoning and the medical care that you're receiving.
So Medical Center is proud to introduce Fast Track, a new and improved system designed to reduce patient wait time and increase access to quality care. To access Fast Track, you will check in and be screened at the emergency room to be cleared of any serious injuries or illnesses. Next, a nurse will escort you to Fast Track, where you will then receive treatment. Fast Track is limited to only treating minor illnesses and injuries. Some treatments offered by our top providers at Fast Track are for sprains, asthma, abdominal pain, as well as cold and flu symptoms. For more information regarding Fast Track, please contact 928-729-8608. Ahiet.